I'm Dr. Sally Morgan. I'm a clinical psychologist and I work in child and adolescent mental health. And I first became aware of the plot the dots movement and in particular statistical process control when I'd been brought into a team to help manage their waiting lists. They had very, very long waiting lists for children trying to access mental health services. And I think I'd been there about a month and I remember thinking, I don't think I'm actually making a difference here. But it was so easy to go onto the Plot the Dots website, download the tools, plug the numbers straight in. And sadly, as a result of doing that, I realised that actually the waiting list wasn't changing at all. It was actually staying the same. And then I started thinking, well, why is that? You know I'm working incredibly hard. I know my colleagues are working incredibly hard. What's going on here? So when we started to unpack the data, we realised that the referrals into the team had doubled over 3 years, and actually nobody had noticed that. My fellow clinicians actually, I think, were surprisingly relieved how easy it was to use the tools. None of us are statisticians. We don't do this for the day job. We needed something that was really easy to use but could tell a powerful story with the data. And they were really pleased that actually it wasn't them, it wasn't the way they ran the service. We could have a completely different conversation with management about what was going on and come up and solve the real problem about what was happening in the service. What we had to do was have a complete rethink about what the service needed to look like, and that meant going to the provider organisations and to the commissioners and redesigning the service. Statistical process control is absolutely benefiting the patient in the long run. I know as a result of doing that analysis that team has been redesigned and that waiting lists are coming down now, and that's absolutely essential for children and young people who desperately need mental health services.